Hi guys, okay, I want to get right into it. What is microblading and what does the procedure even entail? Let's start. Okay, so microblading is a form of semi-permanent eyebrow tattoo where I'm implanting semi-permanent pigment into the dermal layer of the skin. This makes sure that after 1 to 3 years, most of your eyebrow is gone. And I want it to be gone so that it can keep making little hair-like strokes that look a lot like real hair versus that traditional dark tattoo that, to be honest, I'm not just really a fan of. What does the procedure even entail? Like, what goes on once you come into my salon? Okay, so the procedure is I numb you up for 15 minutes before and then I numb you up during. So as far as pain level goes, you're not really gonna feel much at all. It's 2 passes. The first pass, maybe you'll feel at a pain level 0 to 3 out of 10. A lot of people fall asleep and most people describe it as a light cat scratch. The second pass, you feel no pain at all because I put another layer of lidocaine. It stings a little bit like alcohol in a wound and you feel nothing at all. Again, it's a very comfortable procedure. People honestly say they feel like they're in a spa. It's pretty relaxing. It's not a big deal. After I numb you up for 15 minutes, I map it out based off of your natural facial features. That means I'm never using a stencil or a one-size-fits-all. It's always unique to your face so that I ensure I give you the best look for you. That means I'm working off the bridge of your nose, the end of your eye, the arch side of your pupil, and creating a really nice classic shape. I love to stay with classic. I can do minor variations, like maybe a little fluffier in the front, a little bit shorter of a tail, but I can't do too many variations. That would be too trendy, where maybe 5-10 years down the line, you're like, what did I do? I always keep it pretty classic. There are 4 factors that affect how well the eyebrow heals, and it's going to be pre-care, post-care, skin type, and then what I do in person. The pre-care is all listed in your confirmation email. The post-care is also listed in your 6-week confirmation email, and we'll talk through it before you head out. And then what I do in person is make sure that we're going to the right depth and picking the right pigment, and then the only thing I really don't have control over is skin type. If you have skin type that I feel like is not going to work with microblading, I always prefer to suggest a nanobrow. Nanobrow tends to work on everybody, but once you're inside my salon, we can talk about that and see what your best option is. After we complete the initial session, or what I call the foundational session, I book your 6-week follow-up. It is a 2-session process. I always tell my clients I think the eyebrows look good after the first session and I think they look great after the second session, because in that second session I'm able to see how your skin has healed. I'm able to fine-tune, perfect, and send you on your way for at least 1 to 3 years. In your skincare, make sure that you're not using any active ingredients. That's going to be no vitamin C, no retinols, no AHA, BHA, any sort of topical exfoliating acids. We want to avoid those for at least 2 weeks prior. I also want to avoid any Botox or filler in this area for 3 weeks prior. I want the brows to settle and be at their true form before I map it out and start with my microblading procedure. And as always, I make sure that I get approval on the shape and we're both in agreement before I begin the procedure. If you have any questions, just let me know.